A very good day to Doctor and my fellow batchmates. We from Group 2.1 will be discussing on how to advise a COVID-19 patient with dental emergency. Without further ado, let me introduce myself. I'm Abhinaya, and I'll be covering the parts of introduction, tooth abscess, and broken tooth. So let us start. Looking at the introduction, dental care facilities in some countries are completely closed, or they only provide minimal treatment for emergency cases. This somewhat deprived patients in need of required urgent dental care and also increases the burden on hospital emergency departments. There are some other countries which still provide regular dental treatment. This can increase the nosocomial COVID-19 spread through dental care facilities. According to studies carried out in Beijing, China demand for urgent dental treatment decreased by only 38%. This shows that the public in need for urgent dental care even during this pandemic will always be essential. However, given the high transmissibility of the disease and considering that the routine dental procedures usually generate results, alterations to dental treatment should be considered to maintain a healthy environment for the patients and the dental team. And also due to the possibility of COVID-19 recurrency and the fact that some virus can be present in saliva for as long as 29 days after recovery. The management of recently recovered COVID-19 patients was also considered in these guidelines. 29 days after recovery is still considered very long. So looking at tooth abscess. What is tooth abscess? Tooth abscess is a pocket of pus caused by bacterial infection, and the symptoms like severe and persistent tooth pain or swelling in the face or around the gum are usually the signs of the infection, which may need antibiotic treatment. And if the abscess is draining to the mouth, rinse your mouth regularly with warm salty water and take anti-inflammatory drugs or painkillers if needed. Looking at broken tooth, if let's say you've got a chipped tooth and it's not painful, that means you don't actually need an immediate action to be taken. What you have to do, it will be fine if you just leave it and you can see your dentist for restoration later. If the broken tooth is sharp, sensitive, or cutting your tongue, or even if it is deeply broken, let's assume that it's broken deeper till it reaches the pulp. So then you can purchase a temporary filling material and you ensure your tooth is dry and place that filling material over that surface that is exposed. If required, take a regular painkiller to help with pain and discomfort. While waiting to have the tooth restored, maintain a good oral hygiene routine. Brushing your teeth regularly, flossing your teeth, or using interdental brushes combined with a low sugar diet to prevent any decay from occurring or existing decay from getting worse. Stress and anxiety can lead to bruxism, which results in fractured teeth. To alleviate this, wear your night guard or use a whitening tray, but make sure there's no whitening gel in it. And this night guard or whitening tray is used to separate your teeth at night time to protect your teeth from any injury or trauma. So looking at the image, this is the night guard and this is known as the whitening tray. So yeah, that's all from me, and I'll pass the presentation to my group mate. Thank you.
Now I'll be talking about loose implant crown. First of all, there are many causes that your tooth implant could become loosened, such as bone loss, loose dental crowns, peri-implantitis, which is the most common type of gum disease associated with dentures. Although it's rare, it is not ignorable whether the implant fell out or still intact but feels loose. So when this happens, the patient is asked to stay calm if the implant crown happens to fall out. Use hot salt water rinses to keep the implant crown safe and gum clean. A simple surgery procedure might be needed in case of gums grow over the implant. Take extra precaution during eating if the crown remains loose but not falling out. The patients are advised to call their dentist if the crown is very loose but still attached. Next, I'll be talking about wisdom tooth infection. So, what is wisdom tooth infection? The gums around or over a wisdom tooth is infected. In other words, it is also called as pericoronitis. The infection will lead to painful, red, and swollen gums. If you have a wisdom tooth infection, the first step you have to do is rinsing your mouth with warm salt water and take regular painkillers. To reduce the inflammation in the site, keep your head raised. For example, you may sleep with numbers of pillows. And antibiotics are required and you are advised to call your clinic if you have a bad wisdom tooth infection. It's better to be safe than sorry, so seeking your dentist as soon as possible is the best option when you know it's going to be worse.
Hi, I'm Cheng and I'm here to tell you about how you can deal with sensitive tooth during the COVID-19 pandemic. You're having sensitive tooth mainly due to your exposed dentin as a result of receding gums, or you're having a decay or large fillings. So you can take anti-inflammatory tablets like ibuprofen and paracetamol to relieve the pain. But remember, don't take too much as it may cause overdose. Also, you can rub desensitizing toothpaste like the Sensitive Repair and Gum around the tooth and repeat for several times a day. Then you can also use salt water to rinse your mouth to reduce the dental bacteria that create the environment in your mouth. Next, you can use ice pack to compress on the pain area to relieve it. Also, you can use the anesthetic gel like the Oragel and apply to the sensitive area to help numb the pain. Next, what if your crown, your vernier, or your bridge is fall off or lost? The biggest fear is the danger is that you may swallow or inhale the prosthesis. So I recommend you to go to a nearby dental clinic. But what if the dental clinic is not operating? So now you can buy a temporary dental kit from pharmacy. Then before you apply the cement and stick your prosthesis back, you must try to fit the prosthesis several times to your tooth so that it is fitted correctly and the bite is correct. So now you can apply the cement and stick it back, but now you need to bite firmly for about 5 minutes. Okay? And then do not try to replace any lost vernier as they are not stable because it doesn't fit you. Thanks.
A very good afternoon to all of you today. My name is Chang Chiwei and now I'm going to continue with bleeding gum during brushing. So basically, bleeding gum is not an emergency situation. All patient needs to know is that they need to maintain a healthy oral hygiene routine daily. For example, firstly, patient needs to brush at least twice a day gently, most preferably after every meal. Next, patients should also use floss or interdental brush in order to keep their gums healthy. Patients should also use mouthwash twice a day, and the brand names are suggested such as Cosodil or Kin. And lastly, home remedy is suggested, for example, rinse with warm salty water in order to keep the intraoral cavity clean. Loose or rubbing denture problems is commonly seen in elderly patients, and those patients can consider using denture fixative as temporary solution. For example, Fixodent or Polygrip. Next, if the denture is too sore to wear, do not wear it until you can see a dentist. If any part of denture is sharp, try to adjust with an emery board, which is commonly used for fingernails. However, it is not advisable, but it might be helpful under current emergency situation. In conclusion, these are general guidelines and the final decisions will always be made depending on the practitioner's judgment. For example, if the required treatment cannot be provided for the patient, the practitioner's judgment and evaluation can provide for other alternative management methods. Otherwise, the treatment should be postponed and pharmacologic management of the pain or infections such as analgesics or antibiotics should be considered. That's all from my group, and stay safe and be healthy everyone. Thank you.